Hi, I'm Danielle Pepper. I'm a registered nurse and I am a nurse over in the med spa.
Hi, I'm Sierra Johnson. I'm the esthetician over here in the med spa, and I've been a licensed esthetician for 3 years now. Great question. You want to be sure to be using a non-comedogenic moisturizer on your skin. Epion's has 4 different options. We have one for every skin type. All of them are non-comedogenic, and they also have the hyaluronic acid, which is an amazing product for hydration and driving that moisture into the skin a little bit deeper. And you just want to make sure you're not using a cleanser that's stripping your skin of its natural oil barrier. But yeah, we can hook you up with some great moisturizers here in the med spa.
It's best to begin any laser hair removal service in the late fall or early winter. The reason being is because we can't laser you if you've had any recent sun exposure. So if you're tan or if you have a sunburn, we don't want to pull the pigment out of your skin. Most clients will buy a package of 7 because it does take between 6 to 9 treatments per area. And it also, you come in 8 to 12 weeks in between each appointment. So it typically takes a while, so people like to begin in the fall or winter so that by next summer they're ready to go.
Getting facials all year round is beneficial, but if you do try to get facials in the winter time, it's a little bit easier actually because you're not as limited. Chemical peels can be done mostly in the fall and spring months and the winter months, but you don't want to do them in the prime time of summer when you're exposed to a lot of sun. You can cause hyperpigmentation, and that's typically the opposite of what we're trying to do with a chemical peel. And you don't have to worry about getting too dried out or anything. A peel will make you flaky. That's actually a goal of ours when we do peels. We do send you with an essential recovery kit after each peel, so you will use that for the next like 5 days after a peel, and it'll keep you nice and hydrated.
So honestly, we get this question a lot over in the med spa regarding when to start Botox. And really it depends on the person. Some of us are more genetically predisposed to those finer lines and wrinkles. So we like to just say once you start seeing them kind of settle into your skin, or maybe they become bothersome to you, to come on over and get a consult. We won't treat under the age of 18, but we do kind of assess each person's face and make a treatment plan specific for you.
So actually, we don't recommend having a product that contains both SPF and moisturizing products. We want them to be separate because SPF is meant to be more of a topical, whereas moisturizer is meant to kind of penetrate down into that dermis, the deeper level of skin. Um, and that way, if you have a moisturizer, it's safe for morning and night, which is kind of nice. And then you're only worrying about sunscreen application in the morning and then every 2 hours after that. We do carry 2 different SPFs in the med spa here. We have Elta MD and the Epion's tinted and the non-tinted. And they're all 40 to 50 SPF and physical sunscreens. They can target anything from rosacea safe SPFs to hyperpigmentation, acne prone skin types. They're safe for all sorts of different skins. So if you have any questions, you can come see us at the med spa and we'll get you set up on the right one.
So as far as consultations, what we do is you come in for an hour, you spend up to an hour with us, and you can discuss anything from skincare services to lasers, veins. It's really an opportunity for you to kind of come to us with your concerns and figure out the best treatment plan for you. Following a consultation, usually we'll show you the product line and explain that. We can send you home with some samples. So it's just a good time to kind of learn a little bit more about some of the things that you may have questions about. And then also following the consultation is when we can get you an appointment booked. So it's a really good way to kind of get your foot in the door here and kind of give us the opportunity to specialize a plan for you. And the number is 406-455-2845.